So I'm Steve Barry, and this is my technique errors project. So some of the common technique errors are elongation, cone cutting, foreshortening, and overlapping. So I believe that it is imperative to avoid any of these mistakes so that we're not overexposing ourselves or the patient to unnecessary radiation. So for the first one, I have elongation. Elongation is just the lengthening of the teeth and surrounding structures. So I think the best way to avoid elongation is to use an actual XEP. So for example, if we have our PID right here and our patient's mouth here, we'll have our XEP here. So you always want to get a side view so that you have a better angle so that it's parallel. And then this is just an example of an elongated PA of number 8 and 9, and this is a corrected one. And then cone cutting is just an interference of the inside of the tube caused by misalignment. So the best way to avoid cone cutting is to just recenter the actual tube head and the PID to the area to be exposed. So right here you can see where it was actually cut right here. So this is where the cone cutting would be, and this is just a corrected version. Foreshortening is just an overangulation of the X-ray beam. To correct foreshortening, you just want to decrease the positive vertical angulation for maxillary projections, and you want to decrease the negative vertical angulation for mandibular projections. So right here, two PAs, and this is just one foreshortening, and this one it isn't cut off. So the foreshortened ones are the ones that are cut off right here. And overlapping is when the horizontal angulation is not aligned correctly so that the x-rays pass through the teeth. To fix this error, you just want to align the receptor so that it passes straight through the teeth. So right here, you see these white shaded areas. Those are where they actually overlap. And right here, you can actually see right through the teeth. And that's a correctly aligned one. So in conclusion, the best way to avoid making any of these mistakes is to pay close attention to detail and correcting any unnecessary mistakes so that you're not causing over radiation to yourself or the patients.